as Obamacare, the rollout approaches, we are seeing now that there are 10 states where you will lose your coverage. First one, California. 58,000 will lose their plans under Obamacare. The first bomb dropped in California with a mass exodus from the most populated state Obamacare exchange, Aetna. The country's largest insurer left in July and was closely followed by United Health. Anthem Blue Cross just pulled out of California's Obamacare exchange for small businesses as well.
Wow.
So
54% of Californians expect to lose their coverage. 54%.
No, but you can keep your doctor.
Yeah.
You'll be able to keep it. If you have your coverage and you like it, you're going to be able to. And what did we say? That's not true. Mm-hmm. You're not going to be able to because no one will be in business. They won't be able to be in business, so you will lose it. And what he was trying to argue was, well, no, if they just stay in, if everybody just sees the unicorns that are flying out of my pants, everything will be fine. And we'll say, Mr. President, why are unicorns flying out of your pants in the first place? But it probably goes something along the lines of wolves in wolf clothing. So I don't really know. 54% of Californians will lose their coverage. Next, Missouri. Patients of the largest state hospital system, which spans 13 hospitals, including the St. Louis Children's Hospital, will not be covered by the largest insurer on the Obamacare exchanges. Anthem Blue Cross Blue Shield covers 79,000 patients in Missouri who now may seek subsidies on the Obamacare exchanges, but will not be able to see doctors in the Anthem Blue Cross Blue Shield coverage system, including the Children's Hospital. So if you have a child and you need help in the Children's Hospital and you have Anthem Blue Cross Blue Shield in Missouri, you can no longer get covered with your insurance. Congratulations. But don't worry. The rest of America can pay for it. Why have a private company do that? Let's just take it out of the taxpayers' money. We'll just do it. Because we got nothing but money, don't we? I mean, why take it out of the coffers of a private company when we can just take it away from other people through taxes? It's so much simpler. In Connecticut, Aetna, the third largest insurer in the nation, will now no longer offer insurance on the Obamacare exchange in its own home state where it was founded in 1850. I had a guy talk to me about insurance. You know, you can do these things where you put in money. It's like your 401k. You put in money and then it's insured and it's, you know, you get a payback when you retired. You know what? I don't even know what those things are called. But it's like 401k. And everybody says, oh, it's so great because of insurance. And I talked to this guy and my investment guy, and he said, Glenn, it's the safest thing out there. And I said, no, it's not. No, it's not. Food, guns, and the Bible is the safest thing out there. And he said, this insurance company is from Connecticut, and it has been in business since before the Civil War. It survived the Civil War. And I said, I don't think it'll survive what's coming. I just don't think it will survive what is coming. That's crazy talk. Really? Aetna can no longer insure in its own home state where it's been insuring people since 1850.
Is this the insurance carrier he was talking about?
No.
Oh.
No. In Maryland, 13,000 individuals covered by Aetna and its recently purchased Coventry Healthcare will not be able to keep the insurance plan if they want subsidies on the exchanges. Aetna and Coventry canceled plans to offer insurance in the exchange when state officials wouldn't allow them to charge premiums high enough to cover their costs. South Carolina. This is why, by the way, they want to enact this right away. This is why the president wants this to happen. Because if you can just he doesn't want to get the elites into it and the other companies, the other big companies and stuff. What he wants to do is put everybody who doesn't have a choice, all the people at the lower end, into this, so it will collapse the other insurance companies. If he can just collapse enough of the insurance companies, then there's no way out. A year from now, when they say they want to fully enact, they'll have to completely redo everything, and you will have a single payer system. Because this next 12-month period will collapse enough of these insurance companies to where the whole thing won't work anymore. And you will have destroyed the American health system. And so you will have to go back and now socially engineer it, and you'll get a Soviet-style healthcare system.
And that process has already begun.
It already has, clearly. We're on number 5, South Carolina. 28,000 people were insured by Medical Mutual of Ohio, South Carolina's second largest insurance company, until it decided to leave the state entirely in July due to Obamacare's vast and quite complex new regulations. Company spokesman Ed Byers said Medical Mutual's patients will be switched over to United Healthcare plans instead. New York. Aetna pulled out of New York's exchange in late August in an effort to keep their plans financially viable. In New Jersey, 1.1 million Aetna customers are at risk in New Jersey, where the leading insurer will not be part of the exchange. 2,600 patients purchased individual plans with the company, but any looking to take advantage of subsidies on the exchange for an affordable employer-based insurance will not be able to do it with Aetna. The next one is Iowa. Wellmark Blue Cross and Blue Shield, Iowa's largest healthcare insurer, decided not to offer plans in the exchange. It sells 86% of Iowa's individual health insurance plans. Wisconsin, 2 of the 3 largest insurers in the state will not offer plans in the exchange. United Healthcare and Humana patients will have to get new health insurers to buy insurance on the Obamacare exchange. In Georgia, 5 insurers, only 5 are participating in Georgia's Obamacare exchange. Medical Mutual of Ohio left Georgia, Indiana, as well as South Carolina due to Obamacare regulations. Aetna, along with Coventry, also decided to go against participating in the Georgia Obamacare Health Exchange. So let's just look at these states. California, progressive. Missouri, I would say borderline. I mean, that's one that's battling for its soul.
It's purple.
Connecticut, progressive. Maryland, progressive. South Carolina, battling for its soul. New York, progressive. New Jersey, progressive. Iowa, progressive. Wisconsin, progressive. Georgia, battling for its soul. I mean, what you don't see on this list, you don't see Texas. You don't see Oklahoma. You don't see Utah. You don't see Wyoming. You don't see
Indiana.
I mean, hello. What do these states have in common? This is what's coming